Hey everyone, it's Dr. Lukin here again. Today, what I wanted to do is really jump in and talk, a little bit more about emotionally focused therapy for trauma. As if you've been watching our YouTube channel, you'll notice that we talk a lot about, difficult experiences, emotions, traumas. As you know, there's a video on EMDR for trauma. So today we wanted to shift it a little bit and move away from EMDR and talk about other approaches that might be helpful for trauma or painful events. Today, we want to talk about emotionally focused therapy. Now, emotionally focused therapy, just a kind of a brief overview, was designed by Dr. Sue Johnson. The initial treatment has been designed for couples work, but in the past couple of years has really been moved over and also applied to working with individuals. Now, what is trauma and how can EFT be helpful? Now, trauma, as most of you might know, is just a painful experience that has occurred in one's life. We are moving away from defining it as a behavior. For instance, if you were in war, for example, right, and now are moving closer to an internal experience for what might be overwhelming or traumatic for you. Oftentimes, trauma occurs in interpersonal dynamics, be it with parents, be it with siblings, just strangers, right? Unfortunately, in cases of verbal abuse, physical abuse, sexual abuse, right? There's some level of betrayal, of trust and safety within other individuals, and this is where I feel EFT could potentially be very helpful because EFT really focuses on underlying emotional needs. And these emotional needs could be a need for nurturance, a need for safety, a need for belonging, a need for appreciation, right? Basic needs that we are all born with. Now, when a trauma or an interpersonal trauma happens, as you could probably tell, there's a rapture, if you will, of the needs that were being met. For instance, safety, right? If there's verbal, sexual, or physical abuse, you'll notice that there's some sort of emotional need that's no longer met. In some of these instances, for example, is safety or nurturance, right? When these emotional needs are no longer met, or there's a significant break in those emotional needs being met by maybe either a significant other or parents or siblings or friends, right? We're left with those emotional needs still ever be present, but at the same time, those needs are no longer being met. And that's where we feel alone, isolated, sad, hopeless, right? The way EFT could really be helpful is that the focus or the mindset of a clinician when they're working within the EFT framework for individuals and trauma is to be able to start talking at length about what some of the emotional needs might be, how they played out in individual's life, and incorporating the traumatic event within that dynamic where the client and the clinician expand on the idea what needs afterwards have no longer been met. And once an individual is able to tap into what the emotional needs were for that individual, how trauma had really severed the ability for that individual to be able to meet those needs, hopefully through the work with a therapist, what happens is that individual is able to empower themselves again to own those feelings, that it's something that they need and that they want. And now the second part would be to start looking for people out there that would have what we call a corrective experience, where an individual is again find themselves in a safe environment, again is able to feel nurtured by somebody else. And again, the reason why this is so powerful is because this individual is now intentional in being with groups of people or a person who is able to repair the interpersonal trauma that occurred in the past. And that's really a big piece, as you could tell, right? The person has had those emotional needs met, something happens, so those emotional needs are no longer met completely or to the degree that the person needs, right? I feel isolated, distant from people. Potentially they come in to see an emotionally focused therapist. We get back in touch with those feelings. And now we are intentionally crafting opportunities in our lives in order to repair, in order to find individuals with whom we feel like we belong, find individuals that we feel safe with in order to repair and heal and to move forward. Thanks so much for tuning in. Hopefully, this conversation has given you a little bit about how emotionally focused therapy work could be helpful for individuals, specifically with interpersonal dynamic concerns or interpersonal trauma from the past. Thanks so much as always, and hope to talk to you soon. Bye bye.